very large kidney over here. Okay, because God's gonna compensate. Because that one kidney has to do the work of two. So it's gonna get very large.
And so why wouldn't you expect an ectopic?
Why would I?
Why would you not expect it to be ectopic?
We always expect it.
You do expect
Yeah. If I don't find a kidney here, I expect it to be down here.
Okay.
And if it's not there, then they have a unilateral.
Got it.
Okay? If I go over here and the kidney is the same, the normal size, 9 to 12, I'm gonna go sit transverse on the bladder. Okay, so when I sit transverse on the bladder, what is the area where what is the area called where the ureters go into the bladder? What is this area called? The trigon. Okay, trigon. Okay. Okay. So I'm gonna sit transverse. I'm gonna sit transverse on this area. Okay? Now I'm gonna watch. And periodically I'm gonna see jets. Okay? Those jets tell me, okay, they have a left kidney. But if I sit, now I'm gonna document my time like every 2 to 3 minutes. So that way the doctor can see that I watched this for 15 minutes. I don't know what the protocol is. I just know, I just document my time, okay? Because I want the doctor to know that I'm constantly watching, okay? So if I never see a jet on this side, then I don't have a kidney on that side, okay? But if I see jets coming out from both sides, there are 2 kidneys. I need to go look on the right side again.
So we are able to see that jet in ultrasound?
You can see that jet. And you've got to either print real fast as the jet is highlighted or freeze it and take a picture.
With color Doppler?
With color Doppler. Yeah. You don't have to take a waveform, it's just the fluid in motion. Okay? But if you don't see a jet, after watching about 15 minutes, I don't know what the protocol is, that's just me, myself, then there's no right kidney. Okay?
That's cool.
Just a little FYI. So what can I help y'all with? You're not doing patient care during this class, are you? I didn't think so. Okay, so how can I help y'all with this class? What do we need to go over? We still have another 45 minutes. I'm sorry?
The variant?
The variants?
Yeah.
Yeah, the
Okay.
variants.
Okay, the variant, yes.
I have a question about patella and apex. Are they the same?
The patella is in the apex.
So when you point at it,
Yes.
are you gonna want patella?
You could either do patella or apex, I would accept. Okay, variants.
Elaborated a little bit on the variance of the miraculous.
No, I didn't really talk a lot about that because that's, it's a variant with the pelvis, with the bladder. And I didn't ask you any questions on that. Because when we get into pathology, it's more of a pathology than a normal variant. Why? Because during embryology, you have a urachus, okay? You have an allantois. And if that doesn't close up completely, you can have a tract that's partial or complete, because this is a normal bladder, okay? Here's a normal bladder with a partial urachus. Here is a normal bladder with an abnormal urachus, and this is when you have urine come out of your belly button. That's a complete, this is a partial. Yes,
Do we need to
Got it.
know all the renal function tests?
you need to know about the labs and like creatinine, bun, red blood cells, and then what's that called? If I have red blood cells in my urine, hematry. Because those red blood cells, what's another name for a red blood cell? Erythrocytes. Okay, the normal variants. Normal variants. You've got,
Do we have to know the numbers with regards to creatinine blood level?
no. Okay, so let's go over some of the variants. Yes? I don't have something. Let me see. Let me see if there's more pictures of them in this. Okay, here's a couple. Column of Bertine. It's where you have a splaying of the sinus. A splaying of the sinus. It should be isoechoic as the cortex. It should look exactly the same. Do not measure it. Okay? Column of Bertine is just where you have cortex that dips down into the sinus of the kidney. Dromedary hump. Now, this one isn't a hump, but look how it looks like a pyramid.
Oh, okay.
Okay? You mostly see it on the left kidney. Okay? Is this at mid, medial, or lateral kidney?
It's mid.
It's pretty close to mid. I do see a little bit of hilum here, but they were showing this cortex deformity, but you can see cortex go all the way around. So that's at mid. Junctional parenchymal defect. It's where you have a bite out of the cortex. It's like a bird bite. Okay? Okay. It's just a little triangular defect in the parenchyma or the cortex. Fetal lobulation. You have more than one scallop. Fetal lobulation. Is this kidney at mid, medial, or lateral? Nope. Medial. See the cortex coming in right here?
Yeah.
From here to
the
here?
hilum.
That is medial. That I didn't ask y'all any questions on.
What's that? Sinus.
Sinus lipomatosis is where your sinus has fat deposits in it. Extrarenal pelvis. It's inside the kidney. It looks like a cyst, but it's in the pelvis. Horseshoe kidney. They are fused at the
Oh.
bottom of the kidneys.
Now it makes more sense.
Okay?
One second.
We make our diagnosis by doing a transverse aorta. That's how we make our definitive diagnosis. A cake kidney, we didn't talk about that, but you have one flat kidney that looks like a cake, and it has both of the ureters coming off of a kidney. This kidney will go, this ureter will cross over the spine and go into the bladder at the same area it should. They're not both gonna go on the same side.
So they only have one kidney?
They have one kidney, but it's double the size.
Okay.
I've never seen one.
But if you can't see the ureters, when you're scanning, oh, okay, again, you would look for the jet.
You would look for the jets.
But,
Wait.
Cause the jet will show,
but there are two, but then,
but you still don't see anything in the
still
renal
can't.
fossa.
Missing the
I've never
ureter.
seen one, so I don't know.
Ureter. The ureter.
Okay.
Yellow part.
Just need to make sure.
Okay,
This much.
a pelvic kidney. Okay, this kidney gets its blood supply off the common iliac artery.
Mm.
And then your extrarenal pelvis.
And can you go
A
back?
double,
Yeah, it's,
Renal pelvis.
this is a pelvic kidney. When you do a transplant, it will always be attached in the pelvis.
Mm.
Those things give me the jeebies. Cause you can like feel them with your transducer. Ooh. Gives me the, don't you have those things that make your stomach do flip flops? Yeah, that's one of them for me.
oh,
Cause you can actually feel you probably wouldn't know me cause I'm fat, but, you can actually feel the kidney under your
Really?
Is
skin.
that the transplant kidney that you
The
saw?
transplant
Oh,
kidneys. Because what they do is they attach it to the common iliacs.
So you feel it running?
Huh?
You feel it running inside?
Yeah, it makes my stomach feel weird.
That's cool.
it's in the leg?
No, it's in the pelvis.
What
It's
is
in the pelvis attached to the common iliac.
Okay.
Yes.
So are you saying, that the blood
It's still in the
flow is
pelvic.
usually
It's a
higher
bowl.
in that,
It's a bowl of your legs.
leg.
It's still in the pelvic, but it's like lower.
No, that's just where they transplant them, because they don't take out the kidney.
Right.
Yeah, they don't take out the sick kidney. They just put a new
It's still
kidney.
the iliac artery.
And it's always in the pelvis. It's always in the pelvis.
Why not remove the sick kidney?
I guess
Some function to it.
Extra.